Thanks for watching Psychology Today. Like, comment, and don't forget to subscribe. Fetishistic disorder. Fetishistic disorder, commonly known as fetishism, is a condition in which a person experiences high sexual desire and enjoyment from non-human items, bodily parts, or particular scenarios. The item or setting must be required or important for the individual to obtain sexual enjoyment and satisfaction. This illness is classed as a paraphilia, which is characterized by aberrant sexual impulses and actions. Fetishism can present itself in a variety of ways, such as an attraction to certain pieces of clothing, such as leather or rubber, or to bodily parts, such as feet or hair. In clinical terms, a fetish is an item, such as a partner's foot, that is utilized by an individual to achieve sexual excitation and orgasm. People who have sexual fetishes may require to be touching, wearing, smelling, or gazing at their one-of-a-kind thing, or fantasizing about it, to become or remain aroused, either alone or with a partner. Some people have a desire for inanimate items like shoes or undergarments. Others, like BDSM or voyeurism, may have a predilection for certain settings or scenarios. Fetishistic disorder is considered an uncommon ailment, and it is believed that fewer than 1% of the population suffers from it. It is crucial to highlight, however, that fetishism is not always a pathology or mental illness. Some people participate in fetishistic activity without suffering difficulty or impairment in their everyday lives. Only when it causes severe distress or impairment in social, occupational, or other areas of functioning is it labeled a disorder. It is unknown what causes fetishistic disorder. According to some scientists, it might be the consequence of a mix of genetic, biological, and environmental variables. According to some experts, the disease may be linked to a person's early experiences and exposure to certain things or events. Others feel it has something to do with brain chemistry and how the brain perceives sexual cues. Therapy, such as cognitive behavioral therapy or talk therapy, is commonly used to treat fetishistic condition. The purpose of treatment is to assist the individual understand their fetishistic wants and behaviors, as well as to build coping and management skills. Antidepressants and androgens are two medications that may be used to assist lower the intensity of sexual desire and behavior. Individuals suffering from fetishistic disorder should seek therapy if their fetishistic wants and practices cause severe anguish or impairment in their everyday life. Individuals can learn to control and live with their fetishistic impulses with the support of a mental health expert, improving their overall quality of life. It is also crucial to understand that fetishism cannot be cured. People with this disease can learn to regulate their urges and emotions with counseling and support. However, open and honest communication, permission, and limits are essential for the individual and their partners. It's also worth noting that not all fetishes are problematic or destructive, and possessing a fetish should not be stigmatized or shamed. A fetish is a natural element of human sexuality, and it is only deemed a problem when it produces severe suffering or impairment in social, vocational, or other areas of life. In essence, fetishism is a condition in which a person experiences high sexual arousal and enjoyment from non-human items, bodily parts, or specific settings. The precise causation of fetishistic disorder is unknown. However, it might be caused by a mix of genetic, biochemical, and environmental factors. It's vital to remember that not all fetishes are troublesome or dangerous, and possessing a fetish should not be stigmatized or shamed.